Hi guys, welcome back. This time we talk about scapular region. Scapular region is the posterior aspect of the shoulder. Also, this area may be considered part of the back and posterior thoracic wall. This is the scapular region, and we talk about detail. And we talk about this time at the muscles. The first one is the deltoid muscle. The origin is the lateral third of the clavicle acromius spine of scapula, and the insertion is the middle of the lateral surface of the humerus. The nerve is the axillary nerve. Blood supply has two blood supply. The main one is posterior circumflex humeral artery, and another one is the deltoid branch of the thoracoacromial branch. And function is the abduction, median and lateral rotation. Don't forget of the arm. And we talk about supraspinatus muscle. Of course, is superior from the spine, and the origin is the supraspinous fossa of scapula. Insertion is the greater tuberosity of humerus. Origin, insertion, and nerve supply is the suprascapular nerve. Blood supply is the supraspinatus artery. Don't focus. Supraspinatus muscle, origin supraspinatus fossa, nerve suprascapular nerve, blood supply supraspinatus artery. The action is the abduct the arm and stabilize joint. Deltoid is abduction, and supraspinatus is also abduction. Don't forget that. And we talk about infraspinatus muscle. So it means it's inferior muscle. Huge and beautiful muscle. Origin is the infraspinatus fossa of scapula, of course. Insertion is the greater tuberosity of humerus. And nerve supply is the lower subscapular nerve. Lower subscapular nerve. Remember that. Blood supply is the suprascapular artery, and action is the lateral rotation of the arm. And another muscle is the teres major, the major one. The origin is the lower third of lateral border of scapula, lower third. And insertion is the medial lip of bicipital group of humerus. Nerve supply is lower subscapular nerve. Don't forget, an infraspinatus muscle and teres major have same nerve supply. And blood supply is the circumflex scapular artery. Action is the medial rotate and adduct the arm. So they have two of them, they have same nerve supply, but the function is actually opposite. So we talk about teres minor, the minor one, and the superior one. The major is the inferior one, and minor one is the superior one. Origin is the upper 2/3 of lateral border of scapula. And insertion is the greater tuberosity of humerus. Nerve supply is the axillary nerve. Do you remember another muscle we talk about that actually supply an axillary nerve? Of course, don't forget that is the deltoid muscle. And blood supply is the circumflex scapular artery. Action is the lateral rotation. Don't confuse lateral rotation and medial rotation muscles. We talk about later, much more easier. So this is subscapularis muscle. Subscapularis. Origin is the subscapular fossa. Insertion is the lesser tuberosity of the humor. Nerve upper and lower subscapular nerve, and blood supply is the subscapular artery. Oh my god, subscapular. It's not confusing, it's easy and busy. action is the medial rotate of the arm. So we talk about medial rotators and lateral rotators. Remember that, don't forget, screenshot whatever you want. Deltoid, teres major, subscapularis muscle, 3 of that is the medial rotators. Lateral rotators is the teres minor, infraspinous muscle, and deltoid again is the lateral rotators. So don't forget that. So we talk about rotator cuff muscles. Rotator cuff is the tendons of the subscapularis muscle, suprascapularis, infrascapularis, teres minor muscles make rotator muscle. The tone of these muscles assisted. This is a function. The function is the tone of these muscles assisted in the holding a head of humerus. They hold it like this, a head of humor. In glenoid cavity of the scapula during movement of the shoulder joint. So subscapularis, suprascapularis, infraspinatus, and teres minor. If you wanted to memorize it, take screenshot of this picture. It will easy for you, I know it. And we talk about another space, another favorite space, quadrangular space. The quadrangular space is a small and four-sided space in the posterior shoulder or scapular region. They are same, posterior shoulder or scapular region. It provides a passage for important nerve and artery. So we talk about a boundaries, of course. It has superior, inferior, medial, and lateral. The superior is the teres minor. The inferior is the teres major. Medial is the long head of triceps medial, and lateral is the surgical neck of the humor. If you want to memorize by vision, take screenshot. So we talk about the content. 2 important structures pass through it: axillary nerve and posterior circumflex humeral artery. These 2 you need to memorize it. I know you're a professor. Love it so much. Take screenshot, and I hope you enjoy and understand it. If you don't understand, please watch again until you understand.